Welcome, everyone. Thank you so much for taking the time to join us this afternoon. PPMD is happy to host this webinar on planning for a safe and successful return to school. We recognize that the Duchenne community is really torn on whether to go back to school in person or virtually or some sort of alternative means for education as we look toward this next school year, and that can be a really stressful decision. And we fully recognize that that decision is unique to every family and their own individual circumstances. And we support all PPMD families and all Duchenne families, regardless of what that decision may entail and look like for each of you. But within that in mind, we really want to dig a little bit deeper into, at least this week, in-person return to school, what that looks like, and how to be as successful as possible as we look forward to this upcoming school year. So thank you everyone again for joining, and I think we're going to have some really great conversation today. I do want to share with you, we recently provided updated Education Matters guides for parents and teachers, and those are available on our website. You can get PDF versions as well as order paper versions of these. These are updated from the previous installment that were several years old and a bit outdated, and so we're really glad to offer this resource. It's divided into 3 different volumes based on age and level of education. So we've got one for diagnosis early childhood that's targeted for more of the preschool and elementary school ages, one for middle school into high school ages, and then, you know, the older guys as we're looking at high school, college, and after. So we're really excited to have this resource available for you. Go ahead and check it out on our website. If you've got any questions for us, let us know. We think this will be a really great resource to help guide and educate your educators within that school setting for what it means for families with Duchenne and how to help them be as successful as possible. So with that, we're really excited to have some fantastic speakers with us today. We're going to talk about a few different arenas of return to school. So we have Wendy who is a doctorally prepared nurse practitioner who's going to talk a little bit about the primary and complex care perspectives, including some general pediatric sorts of considerations for return to school. Dr. Richard Schell, a pulmonologist from Nationwide Children's, is going to talk about pulmonary considerations. And then we also have Alexis Hazlitt, who is a nurse and the coordinator for the Duchenne Clinic at Children's Mercy Kansas City, who's going to talk a little bit about coordination amongst your medical team and your school team to, again, ensure as much success as possible. So with that, I'm going to go ahead and turn it over to Wendy. Wendy, we are just so excited to hear what you have to say about planning for a safe and successful return to school.
Thanks so much, Rachel and Amanda, and everybody at the PPMD team. I'm a family nurse practitioner who's worked in the Neuromuscular Center at Cincinnati Children's for the past 2 years. I have the fortune to be able to work with Drs. Tiana Rabowski there. Prior to that, I was a primary care provider for children with medical complexity in our complex care center at Cincinnati Children's. So I've got 8 years of experience taking care of those kids in primary care. So we'll talk today about, hold on one second, sorry, I'm operating 2 computers, so hang in there with me. We'll talk today about returning to school, methods to keep your son safe. We'll discuss recommendations for vaccinations during COVID-19, and then we'll review some developmental considerations during the pandemic. So COVID-19 has really changed our world in unexpected ways. Did you ever think that on New Year's Eve 2019 that we would be faced with the things that we are today? We had hopes and dreams, and all of that's changed. So now we've got social distancing. We have to wear a mask. We talk about hand washing all the time. We're inundated with information from our state legislators, the news, and social media. We've seen data about risk to those with chronic disease, and we need to make decisions that are best for our families. Now we're being asked to send our children back to school. And like Rachel said earlier, it's quite a decision to make. In my practice at Children's, we are asked daily about what our recommendations are. And ultimately, the short answer is the decision to return to school is going to be individualized based on your child's circumstances. So let's just review some COVID-19 symptoms. Most of you probably have heard all of these ad nauseum, but I thought I'd take a quick minute to review, and this is by CDC guidelines. It is fever, cough, nasal congestion or runny nose, sore throat, shortness of breath, diarrhea, nausea or vomiting, fatigue, headache, muscle pain, and poor feeding or poor appetite. And so many of these symptoms can be explained by a variety of different viruses, not just COVID, but now we have to think about COVID when our child gets any of these symptoms or if we get any of these symptoms. I just wanted to quickly review some of the data from China that was out also on the CDC website. 4% of kids, and this is in child data, 4% of kids are going to be asymptomatic with zero clinical signs or symptoms and with normal chest x-ray. 51% to the majority are going to have mild symptoms, including fever, fatigue, muscle pain, and cough. 39% are going to have moderate symptoms with pneumonia and changes on chest x-ray. 5% will have severe symptoms, including shortness of breath, turning blue, and low oxygen levels. And only 0.6% get critically ill, according to that data. And that includes respiratory distress, respiratory failure, shock, or multi-organ dysfunction. So going back to school, should he stay or should he go? In the United States, 2% of confirmed cases of COVID-19 were among persons under age 18. So that's not very many when you look at that group. Each state and local officials were going to make decisions about how and when to reopen schools. And then children, again, tend to have milder disease. So fever is 100.4 Fahrenheit or above, and then 38 degrees Celsius or above. Cough, sore throat, diarrhea are all common symptoms. I reviewed, as I was preparing for this talk, recommendations one of my colleagues shared with me, one of my cardiology colleagues shared this with me, for the solid organ transplant patients who are on immunosuppressive therapy for life. A lot of our boys with Duchenne are on steroids, right? So you think, oh gosh, are they going to be immunocompromised? The kids in the transplant group are actually on bigger doses of steroid, at least initially, and then they stay on immunosuppressive medications throughout their life, right? So even in that group, they're saying that there's no single best answer for all pediatric patients, and then to proceed with caution. We're going to talk about that. So other considerations to think about when you're making that decision to send your son back or not is how many active COVID-19 cases are in your community? What prevention measures are being taken? What kind of things are you doing with the siblings? Because, you know, kids have siblings too that may or may not be affected. And then what if your child was exposed to COVID-19? And then exposure is considered, I thought this was interesting, less than 6 feet for 15 or more minutes. So the recommendations are if others are masking with cloth mask, a cloth mask for your son should be okay. If the other children are not masking, you might want to consider a surgical mask or a cloth face covering with a plastic face shield. If your healthcare provider tells you your son is at high risk, and the way I look at this for kids with Duchenne, do they have respiratory weakness? Are they on BiPAP? Do they have daytime vent settings? Having a surgical mask rather than a cloth face covering might give your son some more protection. There isn't any data about a face shield with no mask. And then in terms of siblings, they should be able to return to school with the appropriate precautions, masking, hand washing, social distancing. And then what to do if your child was exposed. If you know they were exposed, remember, less than 6 feet for 15 or more minutes, then your child should not go back to school. You would want to have your child quarantined for 14 days and then watch for symptoms. So the other considerations, literally just thought about this last night, is what about the IEP? Kids get services through their IEP, right? Speech, OT, PT, and other things. So make sure you're checking with your school to make sure those needed services are being considered, particularly if they're going to do virtual school. And then are they going to still have access to the assistive technology? That would be a question I would ask for schools. What are some things that we can keep our kids safe? So sanitizing the wheelchairs routinely if they're in chairs is going to be important. Wiping down high-touch areas, the push rims, joysticks, handles if you're pushing them. Respiratory equipment. and Dr. Schell will get into this much more, and I'm not going to take his thunder at all. I will defer to him for most of this, but I would say to work with the school nurse to make sure they're safe to use there. As you know, COVID is spread by respiratory droplets, so cough assist puts others at risk if your child would happen to be an asymptomatic carrier. Aerosol treatments can be risky for spread, as well as BiPAP and CPAP. Inhalers in general are okay to use, and that's all I'm going to say about that. Wearing your mask properly is so important. So I'm a dog lover. I had to include dog pictures. Some of you, like Dr. Rabowski, are cat lovers, so I had the cat pictures too. So making sure it covers your mouth and nose. Also, be an example to your son. Make sure your mask covers your mouth and your nose. There's lots of things on social media. I've seen it on my own social media. Your oxygen levels will not drop. You're not going to get a fungal infection that's going to kill you from wearing a mask, and most people don't die from wearing a mask either. Okay, talking about vaccines. Routine childhood vaccines are still recommended. So those are things that get done with your child's well child check. We don't want those to be skipped. Those kind of visits are still very important. If your child's on steroids, of course, they should not receive any live virus vaccines, and those are the MMR and the varicella vaccines, or measles, mumps, rubella, chickenpox. All other vaccines should be given. If your child's not on steroids but might start them in the future, be sure you're talking to your care provider about getting those vaccines early so your child's immune to those diseases. And then just to reiterate, the influenza vaccine, if it's in the shot form, is not a live virus, and all children should start getting those at 6 months. I just wanted to review some of the schedules for vaccines very briefly. This is for kids age 0 to 6, and then this is for ages 7 to 18. One of the biggest questions I've been asked in primary care is, should my child get HPV vaccines? And the answer would be yes. If you get it before age 15, it's a 2-shot series. After 18, it's going to be a 3-shot series. And remember, this vaccine protects against cancer. Meningitis vaccine is a 2-vaccine series starting at age 11, and a second one given at 16. There is another one called Men-B that's for high-risk populations, and I would talk to your primary care provider to see if your child would need that vaccine. And then I want to talk about developmental considerations. The biggest thing is staying positive when you're talking about COVID-19. Kids get on their social media and they hear and see lots of things. Your attitude and reaction may affect how your child approaches this time of uncertainty, so staying calm is really important. Staying positive while helping your son and other children through this uncertainty will absolutely be helpful as well. Making sure that you give lots of reassurance, allowing your children to ask questions and then answering them simply and honestly is good. And then staying on schedule is huge, right? So getting a routine bedtime. And I would ask you to think about what you did pre-COVID. You probably had some pretty good routines there. Lots of people that I've talked to since COVID started, since we started seeing patients again, say their schedules have all been all over the place. I saw a child yesterday who stays up all night and sleeps during the day. Not a great thing when we're getting ready for school. So get back to that preschool routine where you went to bed, we got your kids to bed at a decent time so they can get good sleep, because that's going to be helpful for coping the next day. And then obviously eating healthy foods and having family mealtime is important. Other things to talk about, if they've got questions, ask them what they know. They may have heard things that are not correct, and, you know, watching your resources and answering those questions with the data and facts, not hearsay, is going to be important. I would recommend limiting access to media coverage, the TV and social media. I've seen lots of things on my own page about this information, and it's important to keep that down. The other thing is, frankly, when all the emails that we've gotten as clinicians, especially when COVID started, email after email after email, I limited my own access to some of those because it's just overwhelming. And then for your child, watching for cues of anxiety with irritability and sleep difficulties, that's going to be important. Practice wearing a mask at home to get them ready. If they're not used to wearing a mask, you can wear a mask together. Hand washing, make it fun. Sing the ABC song that gets you 20 seconds. Happy birthday twice gets you 20 seconds. And this is a fun fact. The refrain to Sweet Caroline will get you 20 seconds. Packing some extra hand sanitizer, making sure it's more than 65% ethanol is going to be good. And teach your child to ask for help if he needs it. And, of course, covering your cough. And then if your kid's going to be going back to school virtually, I think it's really important that they stay connected to their friends. And my biggest fear, and with kids with Duchenne, they face risk of isolation anyway. So making sure you're finding creative ways to connect to others is important. Whether it's FaceTime, Facebook actually has a messenger meeting app ways that you can connect with friends, Zoom meetings, gaming where they're talking to their friends. I think that's really important. A socially distanced meetup would be a great idea, making sure you're staying safe, but be able to see and connect to their buddies. And then going old school, writing cards and letters. You can practice things that way. And lastly, I've got some resources. I know this is recorded, so they'll be able to have access to that. But from the American Academy of Pediatrics, the CDC, the Head Start series has some really nice resources for parents. And then the Child Neurology Foundation has lovely videos that are out there right now that would be awesome for parents. Thank you so much for your time. Thank you for having me.
Thank you so much, Wendy. That was such helpful information, and I really want to just reinforce your message about maintaining regularly scheduled vaccinations, flu vaccination, and preventative care visits, like well visits to the pediatrician. I think that this is something that's just really, really important to consider. You know, we can do so many things to prevent spread of COVID-19 and keep our boys safe, but we wouldn't want to, inadvertently increase the chances of them contracting flu or measles or something like this. So I think that this is a really important thing to just really keep at the front of mind, especially as we're starting this new school year. So now we're going to hear from Dr. Richard Schell of Nationwide Children's Hospital in Columbus, Ohio, and he is going to share with us his perspective on pulmonary safety considerations. Dr. Schell?
Almost forgot to unmute. But thanks, Rachel, and thanks, Wendy. We're going to move just a little bit north of where Wendy is. I'm here in Columbus, Ohio. So we are kind of an Ohio-heavy thing here. But anyways, my first slide is really here just to show everybody how busy things can be. I was making this, and I'm thinking, gosh, there's so many things on here, and then I realized that was really the point I was going to make. In the middle of the slide, I've used this many, many times for PPMD and other lectures that I've given, but your sons, yourselves, you're in the middle of this team. There's all these other people that you see in your multidisciplinary clinic, and everybody is telling you what to do. And now on top of all these things that you have to worry about from the standpoint of muscular dystrophy, we've thrown masks and, telehealth visits and school online or school in person and lots of hand sanitizer and all kinds of other things and, invisible viruses kind of flying everywhere. So it's too bad that they are not red or blue or pink and purple and they're flying in the air so that we can see them and avoid them. But, I think that I just really wanted to make a point that we totally understand that this is stressful and that there are so many variables. In fact, there were a couple of things that Wendy just said that I hadn't really thought about putting into the presentation, but I just have a few slides and a few comments, and I think that most of my information here is really a repeat of some of the things Wendy just said, but it's really a focus on true prevention and what we can prevent from a respiratory standpoint, because this is a respiratory virus and it's spread, from a breathing standpoint as well. So the first thing I like to do is talk about chest therapy. There are probably some of you on here right now who have this cough assist device in your home. There are some of you who have it in the home and you don't use it. I know I have many patients who, we've ordered it for because We've noticed that their cough strength is low. This machine, even though the kids don't like it, is our best friend. This is our ticket to stay out of the emergency room. This is our ticket to prevent pneumonia. And I should say that only if you need it. If your cough strength is really still very strong, this is not a device that we order for everybody, but at least in our clinic, and I know many of the clinics around the country, we focus, doing our pulmonary function test and really measuring our pulmonary strength so that we can really figure out exactly when we have to do some prevention. So really what I look at this device as a wheelchair for your lung muscles, just like patients or your boys and your children are in wheelchairs because their lung muscles, their leg muscles don't work as well. I think that the cough assist is really like that, and I originally made this as an animated slide, and I was very proud of it, but on these online web video type productions, they don't work very well. So this is Prevention 101, and I agree with Wendy. There are some concerns that these devices are aerosolizing devices. So, if your child is sick, at this point, most pediatricians and most, people are suggesting going to be tested. If they're negative from the test, I think we still have to take into consideration that when you do a cough or you're using ventilation at night, there is some possibility that those particles can be aerosolized. So I think it's a good idea to take some extra precaution when doing this. However, my biggest point with this slide is that if you have a cough assist at home and you're not using it regularly, get it out, dust it off, and start doing it, because an ounce of prevention is going to go a really long way. Just like the immunizations that we need to prevent, this is really, I think, stretching those lung muscles and clearing out any secretions so that if they do get infected in those lungs, we're starting at a better place overall. I don't know that we can say too much about wearing masks. I am a pulmonologist. I have been hung up on, I can't tell you how many times right now, because our department took the stance that we, actually the allergy department, the ENT department here at Children's, we've taken the stance that we are not providing letters to get out of wearing a mask. There is really no medical reason or medical concern that patients cannot wear a mask. You do not inhale your carbon dioxide level. If we had that as the case with all the masks that surgeons wear all day in the operating room, we would have surgeons passing out all over the place, and we just don't see that. You're not going to get infections from wearing a mask. They are just not harmful to wear. There's a lot of misinformation out there on the internet. They do reduce the spread of viruses. By wearing a mask and your family wearing a mask, you're protecting other people just as much as you're protecting each other. We totally get it. They're not comfortable. I don't like wearing it. They make you feel hot, and many of the young men with Duchenne have some behavioral, issues that may make it even harder to wear a mask. But I cannot stress how important it is to start now, especially if your child is going to go to school in person. Wear it for 5 minutes. Start some kind of positive reinforcement plan. Using one of my moms was using screen time. If you wear it for an hour, you get an hour of screen time. But we can work through some of these issues. And I also know that kids will do many things at school for their teacher that they will not do for us. And I believe that when they see all of their friends hopefully wearing a mask, that they will also wear a mask and go along with it. The mask, as well as really good hand washing, are our best protection. And as many of you know, social distancing is not necessarily a new thing for patients with neuromuscular disease. It's just now it's a focus for everybody in the world to do what I believe many of our patients have done every winter from as long as we can remember. So I have added this one slide here. I didn't want to be political, But this is a recent editorial from the New England Journal of Medicine talking about going back to school and what we really need to do as a society, really, going back to school. So this is the very last sentence or paragraph. And really, it's the fundamental argument that children, families, educators, and society deserve to have safe and reliable primary schools, and this should not be a controversial issue. If we all agree on that principle, then it is inexcusable to open non-essential services for adults this summer, as if it forces students to remain at home even part-time this fall. And I think really what the authors are trying to say is that, school is so important for our kids. We all know that the social aspects of going to school and the social aspects of having friends and doing one-on-one things with a teacher is probably so much better than being online. So with this, and I've cited the article there so people can look it up if you want to read the whole thing. But it is really, I'm putting this here to remind your families, like, don't go out to the bars if you don't have to. Don't go to the amusement parks if they open, or be very careful when getting your hair cut. Like, all those things that if you can create that bubble around you to really get people to understand how important it is to stop the spread of this virus so that our children can go to school and be safe, it will help us all. So that's really all I wanted to say from that standpoint. And I think that the other thing is important too. I mean, many of your children have siblings who maybe your child's going to stay home, but the siblings are going to go to school. I think it's really important for the siblings to understand how important it is to protect their brother, that this, wearing a mask and washing and really getting all of their friends to understand, because if the kids can make the kids understand and we can make our families understand, and that just keeps pushing out as a bigger and bigger bubble, hopefully everybody will catch on. And finally, my bottom line is wear a mask, wash your hands, have a good plan before it starts. And I think, Wendy started talking a little bit about IEPs and things like that, which I think is really important. I think it would be important to talk to the school nurse if you have a relationship with that person. Get the flu shot when it's available, as soon as available, because we do not want to get confused. We need to protect ourselves from, all the viruses, and I would hate people to be getting the flu and COVID at the same time. And if you have the ability to do chest therapy regularly, if it's prescribed, please do it. Brush it off, dust it off. Make your pulmonologist happy when you go to clinic or online, and that you can say we're doing it every day. So with that, I am going to stop, and we will turn it over to our next speaker.
Thank you so much, Dr. Schell. I think that was all really insightful and practical information. And you briefly alluded to the IEP conversation. I'll mention this at the end, but I think this is a good time to mention it too. We do have a companion piece scheduled for Friday. For those of you who have tuned into our Facebook Live Family Fridays, this week's episode is going to be specifically about teachers, IEPs. We're going to have some parents of Duchenne boys who are also teachers. And so I think that's going to be a really great conversation to dig a little bit deeper into that side of the conversation as well. So now we're going to hear from Alexis Hazlitt, who is the clinic coordinator for the Muscle and Nerve Clinic at Children's Mercy Hospital in Kansas City. And Alexis is going to talk a little bit about the importance of coordination and collaboration amongst your neuromuscular team and your school, and a couple other points as well. So Alexis, I will hand it over to you.
Thank you, Rachel. Like she said, my name is Alexis. I am the clinic coordinator at Children's Mercy. I've been in this role for about 3 years. And one of the biggest things I would like to point out for today's talk is that communication is key. Talking with your clinic coordinator and your school is going to be very important. So if you have questions about what your child should be doing as far as a pulmonary standpoint, like Dr. Schell had talked about, reach out to your neuromuscular team, ask them, call your coordinator and say, hey, I think we have a pulmonary action plan, but I'm not sure what that looks like. When should I use it? What does my child need to have before going back to school? That's going to be key to safely returning your child to school. And we've kind of touched on it a couple of times, but set up a meeting with your school to see what precautions they have in place, like checking your temperatures. Will children be screened when they come to school? Different things. Each school district is going to do something a little bit different. Can your child maybe leave the classroom early to avoid crowded hallways? Are there things like that they can do to help keep them safe? Can they sit at the front or the side of the classroom if they do have some behavioral issues that allow them to not be able to wear a mask? Or like Dr. Shell said, maybe they could wear it for a couple hours out of the day. You know, something is better than not wearing it at all. But see what your school can do to help keep your child safe. Ask about an IEP or 504 if they don't already have one. Like Rachel said, they're going to talk more about that later, and that is going to be huge to keeping your child safe and making sure that they get the necessary things that they need while at school. Is your school going to continue to do therapies at school? Are they going to do virtual? Are they going to have less therapy than normal? Those are important questions to ask your school. And if that's the case, talk to your neuromuscular team and let them know that your child may not be getting the same services that they were before, and see what other route we can help you with to make sure that your child gets those needs. One of the biggest things with talking to the school, sign a release of information, whether it's at your school or through your neuromuscular team. With HIPAA, it makes things a little bit more difficult for doctors and your neuromuscular team to talk to people other than other physicians and hospitals and therapists and things like that. So we really need a release of information on file to be able to communicate fully regarding your child's needs. So that is going to be huge. And like we talked about, follow the CDC guidelines. Can't hit on that enough. Wear a mask if possible. We talked about if you're not able to wear a mask, see what accommodations the school can make. Hand hygiene, social distancing, all of that good stuff. And just some helpful tips. Remember to have your child's emergency care card with them at school. You can get those from PPMD, but it talks about, you know, my child has Duchenne. This is what to look for in an emergency. Make sure your child's up to date on vaccines. Flu vaccine's already out there. We recommend you get it every year. And not only your child, but you as a parent, any family members, siblings. Monitor your child for symptoms and don't send them to school if they're sick. And Wendy touched base on the symptoms to look for, but know that symptoms in kids can be a little bit different than adults. So know what to look for in that. And if you have questions, reach out to your team. That's what we're here for. We're here to answer your questions and to help communicate between the school and you and be an advocate. One other thing, I heard the other day someone made this comment and I thought it was perfect. It was, if they understand why, they're more likely to comply. So this goes for your children, your siblings, or their siblings, your teachers, the school. Help them understand why it's so important to keep your child safe. Not that all children, we want to keep all children safe, but especially our kids with Duchenne, and let them know why they may be at more risk and what things that they can help do to keep them safe. And again, if you aren't sure, if you're not sure how to have those conversations, reach out to your neuromuscular team or your coordinator, and they'd be happy to help with that. And that is all that I have.
Awesome. Thank you so much, Alexis. I love that last point, the help them understand why so that they can then comply. I think, you know, so many times our teachers and school administrators, they want to do everything they can to support our boys and to support our families, but they might just not understand how and what that actually looks like. And so I think in that regard, it is just so important to provide that level of communication, whether it's through, you know, the new Education Matters documents or information that we have available on our COVID-19 Hub on our website or other educational materials that are out there, as well as just the advocacy and the power of being, a mama bear or a papa bear for our kids. So that was just really, really great and helpful. Thank you. At this point, we're going to go ahead and transition to a Q&A session. So in the lower left-hand portion of your screen, there's a little chat box. So I see a couple of you have already submitted some questions through that. If you have questions for any of our speakers or questions that we can follow up on after the conclusion of today's presentation, just go ahead, type it in there. Let us know what you're thinking, what you're worrying about, and we'll see if we can't go ahead and dig into it. The first question that we have that I think we will start off with Dr. Schell for a response. This person says, I would like to hear more about siblings and going back to school when you're keeping your son at home. So, the child with Duchenne is staying home, but siblings are going back to school in person. What sort of general insight or advice do you have for those sorts of situations? What's critical to look for in a school's plan for returning in person, and what should that sibling be doing when they get home to help minimize risk to their brother? And Dr. Schell, maybe you can start us off.
Thanks, Rachel. I think it's a hard question to answer, though. I think the first place to start is really to really understand what your school plan is in place, like what kind of precautions they're placing. Theoretically, if you're sending a sibling to school and they're getting exposed at school, the risk is to they can bring it back home with them. So I think it is essential, as I think we've all said today, to have that sibling wear a mask, find a mask that's comfortable for them to wear all day, have them be an advocate for their sibling at home, so that if there are friends there that are not being appropriate with their masks, that, maybe that hearing it from another child or hearing how they could help that other child may be a really helpful way to do it. But hand washing, and I, would suggest that, when they come home from school, they get into the habit of probably changing their clothes. I don't know that the virus can really live that long on clothes, but it certainly doesn't hurt. If you can get them to shower, maybe that would be a good thing to do too. But, I don't know that I would say that you have to do that, but I know that in the heat of it here, when I was working at the hospital, I would come home and I did change my clothes and shower. It made me feel better that I wasn't bringing things home to my kids. But good hand washing, wearing a mask, and making sure that the school understands how important it is for your child's siblings to be protected as well.
Thank you so much, Dr. Schell. I don't know, Wendy or Alexis, if you wanted to add anything to that. Any other helpful hints on that subject?
I agree with Dr. Schell. I will tell you for myself, before I leave work, first of all, I'm wearing scrubs at work only. I don't wear the dress clothes that I typically wear. But I change in my office into clean clothes, put my worn scrubs into a washable bag, and then everything goes in the laundry when I get home, and then I shower. I feel better about that. I know I'm not bringing it home to my husband, and so I think that's not a bad idea at all.
And I think, too, what I'm hearing from Dr. Schell and from Wendy both is finding what that level of comfort looks like for you and your family, and understanding in collaboration with your neuromuscular team what your specific risk profile for your family looks like. Dr. Schell and Wendy both work in a children's hospital where they come into contact with tons and tons and tons of people every day, and particularly those who might be sick. And so, that might look a little bit different than perhaps, a rural school district where class sizes are small. So I think that it's definitely worth having that conversation with your team who knows you and your son, the best, to figure out, this is what our plan looks like, and this is what we have discussed and have come to be comfortable with. The next question we have is about another infectious disease called AFM. So the question is, I've heard about another virus called AFM that creates polio-like symptoms. How can parents with Duchenne boys be aware of those symptoms versus COVID? Dr. Schell, do you want to maybe touch on that a bit?
Yeah, I can certainly try. So I think that this brings up a bigger topic of the fact that we are going to enter the viral season, and pretty much every virus that if you look at the list of symptoms, congestion, headache, sore throat, runny nose, diarrhea, stomach aches, rashes, they could go with pretty much any virus. So it's going to be a very, very confusing period of time as we move into the fall and winter. So, the fact that many people are going to be out of school still and not being necessarily exposed, that might help us. But a quick point, because, we're really talking about going back to school and COVID. AFM is not a virus. It is called acute flaccid myelitis. It is a side effect of getting a virus. At least that's what we think it does. And I think there has been some things out in the internet, so that's why I kind of felt like it was important to address this. So every few years, enterovirus D68, I don't know if that rings a bell with anybody, comes into play, and this was a few years ago, so I think there's stuff on the internet with people talking about how this might be a year that this enterovirus kind of plays a role. It caused, enterovirus D68 can cause hand, foot, and mouth. It's just the same kind of viral things, but people thought that there was an increase in acute flaccid myelitis during the last season. It happens maybe 1 in a million, or one person per every million, but there seemed to be more a couple of years ago. So I would not worry specifically about that virus in particular. I would just worry about good hand washing, wearing a mask. It's going to protect you from all the viruses, not just COVID.
That's really helpful and really insightful. And I love the comment that, there's lots of different viruses, and I think we're becoming a little bit more aware of each of these different types of illnesses, particularly because COVID-19 can look like so many different things. I know even myself personally here a couple of months back, I had a GI bug, and, my husband was like, oh no, Rachel, you have COVID-19, you need to get tested, you need to talk to the doctor, you need to do all of these things. And so we went through that process, and, it wasn't, but we became so much more aware of, what was happening in our home and in our bodies. And so I think that it can be a little bit hard to navigate because there's just so many of these little nuances and potential, secondary sequelae that can occur that it can be a lot. It can be really tough. So I think that's a good question and definitely something to keep in mind. So the next question I have, I think this is probably going to be applicable for a lot of folks. I know this is the case here in Columbus as well. So the question is, our school is going hybrid. What are your thoughts on going in part-time and doing virtual the rest of the time? So maybe, Alexis, you could start us off with any thoughts, tips, tricks on what that hybrid schooling platform kind of looks like and any insight, and then we'll toss it to everybody else for additional comment.
Yeah, I know a lot of schools around here are doing that same model, and I think it's great in the sense that kids can get that social interaction that everybody is very much needing right now. But all those same things that we talked about, if your kid was going to school full time, following all those practices when they are there. And when they're home, find what works for your family. What makes the most sense? Is it you have two kids sending them to school on the same days or alternating days? Really figuring out what works best for your family and for your kiddo.
Wendy, would you add anything to that?
I kind of like the idea of the hybrid model because it gives time for the schools to clean in between. So that might be one of the benefits of that. I love that it gives the kids the ability to socialize. I can't emphasize enough how important that is to young people and to children. So I think that might be a good thing. I think the challenge would be, just like Alexis said, if you've got several kids and the schedules are all different, it may make it tougher on you. But if that's something that works for your family, then I think that's a great option.
And what about you, Dr. Schell? Any last comments on that question before we move on to the next one?
I don't know. It's a hard one, too. I think all of us with children are going through the same kind of questions. I have a a daughter going to college, and I have a daughter starting high school, and our high school has, at least as many of the schools here in Columbus, have decided to go all online. I think that there's, the behavioral issues that sometimes come along with Duchenne, I think can play a role. I am so for like that social interaction part of it. So if you have the ability to do a combined, virtual and in person, I think that's better than all virtual. But I think each student is their own person, and I think we're going to learn as we go forward. Hopefully the schools are really working hard to get that learning and making sure that all the kids are getting that so they don't fall behind.
Absolutely. I couldn't agree more. I really couldn't agree more. So one of the questions that came in was sort of in regard to balancing visits to the hospital for either clinic or for trial participation, and then the whole in-school sort of component. So would you say at any of your centers, have you talked through, the need to quarantine before or after a visit, before or after returning to school, or any sort of other sort of travel considerations for family? Dr. Schell, I know you've got lots of patients that travel from other states. Has that been something that has come up, and what sort of advice are you garnering families?
So, yeah, it does come up. We do have patients that come from, other countries and other states. I think that we've taken special consideration for patients who are coming from what the CDC is, calling high-risk places. I think we also talk about the fact that, here in Ohio, though it seems like it's been decreasing the past couple of days, we haven't had the best luck at flattening the curve, so there's a risk for those patients coming as well. I think that there's a lot of things that we can do with telehealth, until we can actually get everybody back, into clinic, but there's also a lot of things that we can't do with telehealth as well. We have not specifically quarantined people for periods of time before coming to clinic. However, if they are coming from a more endemic area, we're taking extra precautions with the PPE and wearing an N95 mask, and trying to limit the number of people who are going into that room, just mainly to protect us as caregivers. But we have not instituted a specific quarantine. Unless they were coming from an international place, like we've had a couple of other types of neuromuscular diseases come for certain therapies here, and they were quarantined for 14 days and got testing before. Many of the hospitals also have the ability to test if you're coming from a distance, if you're coming for a procedure and you're traveling to a hospital that's more than 2 hours, at least for our hospital, we have the ability to do the rapid 1 to 2 hour test that would be done in the morning before any procedure is done. Otherwise, we also have the ability to test patients before coming to clinic, either 1 to 2 days beforehand, to try to get those results back so that we all feel safer when they come to clinic. Hopefully that helps answer the question.
No, I think that's really great. I also want to toss that to Wendy. I know, Wendy, you're in a similar situation where you are in a relatively bigger city and your hospital is a bigger hospital, and you've got lots of patients who are traveling from all different regions of the country and internationally. So I would love to hear your perspective on that topic as well.
Yeah, we honestly, I don't think any of us have talked about having the families quarantine when they've come from a different, we've got a lot of kids from Texas, Louisiana, some of the Carolinas and things, and East also. So we've not really talked at all about quarantining them. We do, however, insist that the COVID testing is done prior to any testing, just like Dr. Schell said. So we do have the ability for rapid testing that same morning with about a 2-hour turnaround. Or if they are local enough or they have other things that they're going to get done before having, like, for example, PFT testing, or if they are having an MRI, then we will ask for COVID testing before they come to the hospital, so we have those results back. And then we've got some patients, at least one, that live in a nursing home, and then we are absolutely making sure that that person gets COVID testing before they come.
Certainly, certainly. I've got one more question here that I'm going to field, and it looks like it might be the end of the questions that have come in. I was recently reading about the Duke study that just came out regarding the different types and different materials of facial coverings and masks and their level of efficacy for protecting the wearer from, viral particles out in the world that they might come into contact with. So I was curious, Dr. Schell, if you had any insight or any recommendations or any sort of impressions from either that study or just general experience with regarding what types of masks are helpful versus what types of masks maybe are less helpful?
That is a great question. I have not personally read the Duke study, though I've also seen it all over the internet. So what they're talking about is that I'm blanking on what they're called right now, the masks that you pull up over your nose and mouth.
But the gaiters. I think that's what they are.
My understanding of just what I've read a little bit of is that the Duke study was showing that the way that the gaiters kind of conserve moisture in a way allows for more of those particles to get kind of in that, so that if you were to cough or talk, then some of those particles, or it showed that more particles got out with that type of mask than any other mask. So I guess, I've actually been telling people I think those look comfortable. For kids who are not, able to really wear one around their ears, it might be an option. I do have some patients who have tracheostomy tubes, and I thought that was a good option for them to have some kind of mask around their neck. However, with this new data, I do think, and Wendy pointed this out too, that, if you can get them to wear a surgical mask, like the ones that we have in the hospital, those unfortunately need to be disposed of after about 8 hours as well, so you'd have to change it every day. But I think that they also showed, like in that study, that there was a very low transmission of the particles out with a surgical mask, but the transmission with a cloth mask was really very minimally elevated from that too. So I think a good cloth mask that is comfortable, but I guess we need more information about these gaiters before I can really say yes or no, but it appears that from this one study, and Duke is a reputable center, that there's more particles that get through that type of material.
Sure. And I think, Dr. Schell, you really said it best. There's just so much that's still changing. There's so much data that continues to come out. There's just so much that we don't know. And I know that as a parent, that can be just so incredibly frustrating. The conversation today was primarily focused on the return to school physically in person. And so I think, I really want to commend all of the parents that have made that choice to send their kids back, whether your child with Duchenne or their siblings, back to in-school person or hybrid school. I know that was a hard decision for you to make. These are hard decisions regardless of where you land. And so we're proud of you. We know it's hard, and we support you 100% in that decision. And we want you to have the tools to be as successful as possible. And I hope that today's conversation at least provided a little bit of additional insight and, help with navigating this really unprecedented path ahead for us. It's confusing. It's overwhelming. It's just a lot. And so I really cannot say that enough, that we support you. And I think, you as parents made the right decision for your family. And so kudos to all of you for making those hard choices. I think one thing that I want to mention is that we have some really great information already on our website on some of these topics that we've talked about today. We have our COVID-19 Hub landing page on the website that has lots of really great information. We try to keep that as up to date as possible with CDC guidelines, other sorts of webinars, handouts, different sorts of educational and informational content that you might find helpful. We also had a COVID-19 panel during our recent virtual conference, including Dr. Jeff Aletta, who's an infectious disease and immunocompromised populations physician expert. He had some really great insight and information. So I would encourage you, if you're curious, go back to that conference hub and check out that video. I think you might find it interesting and helpful. And then I also want to tell you a little bit about our Family Friday on this Friday on Facebook. I know I alluded to it earlier. So we recognize that the conversation about going back to school in person has a lot of different facets. And so today we really talked more about sort of the medical side of it. But we want to continue that conversation and provide some additional insight and expertise. So this Friday at noon Eastern on our Facebook page, we will have a Facebook Live. And we'll have a couple of different panelists that I think are going to be really, really incredibly helpful. These are Duchenne parents. These are Duchenne parents who are teachers. These are Duchenne parents who are experts in IEPs, 504s, other accommodations, and advocating for those accommodations as well. And they're going to have the hard conversation of how do you advocate for services in a pandemic? How do you make sure that your son is receiving the necessary accommodations to promote learning and safety? You know, what does this look like? What are some things that we should think about? What are some ways to continue to support our boys and being successful as possible in an academic environment? So I would encourage you to check that out. That will be recorded, so you can go back and watch it again later if you can't tune in live. We know that you're all super busy, and sitting down to watch Facebook Live might be easier said than done. So please know that that is an additional resource that's available. And if you find that you're a parent who maybe has some kids going back in person, some kids going virtual, maybe your school hasn't made their decision about what school is going to look like, next week we're going to dive a little bit deeper into virtual online schooling, both in our Wednesday webinar and that accompanying Family Friday as well. So we've got some content coming for you next week for the other side of the spectrum so that we can hopefully give you as many tools as possible. So I think with that, we'll go ahead and wrap things up. I want to thank Wendy and Dr. Shell and Alexis for joining us today. You guys were phenomenal and had just such great insight and recommendations for everybody. And I also want to thank everybody for tuning in. It was great to have you all join us, and we hope that you found this information helpful. So with that, I think we can go ahead and conclude today's recording. So thanks so much, everybody, and have a great rest of your day.